afternoon. Hello, Rhode Island. I hope everybody had an excellent 4th of July weekend and happy Wednesday. It's good to be with you. Good to be with members of the press. I want to thank you all for continuing to tune in. We've been at this for months, our time together at 1 o'clock in the afternoon. And thank you. Thank you for staying informed. Thank you for following the rules. And thank you for tuning in to these press conferences. I'm going to be back here again on Friday at 1 o'clock, this Friday at 1 o'clock. And then starting next week, we're going to try to limit this to just Wednesdays at 1 o'clock. I have a feeling there'll be enough news that we may have to do it more than once a week, but the plan going forward is once a week, Wednesday, 1 o'clock, starting next week. As we move along, obviously people are busier, not home as much, going to work. That's all excellent. I would ask you to stay informed. So if you can't tune in, consider getting the daily email updates from my office. You can sign yourself up for a daily email at governor.ri.gov, and we'll send you an email every day and then a roundup email on Saturdays, governor.ri.gov. Okay, we begin, as we always do, looking at the data, and I'd ask that you please put the data up on the screen. And as you can see, I hope you look at this and breathe a bit of a sigh of relief. I know there's a lot of anxiety as people stay home and watch the national news of what's happening around the country, but I want you to stay focused on what's happening here. And if you look at the data, we continue to trend in the right direction. Rhode Island's test positive rate is low, hospitalizations rate is declining, and you'll see today we're reporting 41 cases, which is a good trend, and very sadly another 2 deaths. It is, every time I read that we have another number of deaths, it's a reminder to me that we are not out of the woods, and every single day, Rhode Islanders die from this virus. So that ought to be a reminder, a stark and harsh reminder to every one of us that people die if we don't follow the rules. And the people who are dying are loved ones, mothers, fathers, husbands, sons, daughters, grandmothers. So it's on us to do everything we can to protect Rhode Islanders. I will say the toll that this virus has taken on our state far surpasses the number of people who have died or been in the hospital or been sick with the disease. We've been at this now for 4 months. Seems like a lifetime. It's been 4 months. And in that time, our lives have really changed. And I want to take a minute to recognize the real suffering, anxiety, insecurity, depression, financial insecurity that people are struggling with. There's not a person in Rhode Island who isn't struggling in some way because of the virus. And I want every one of us to know that some folks, those who came into this crisis poor, vulnerable, sick, lack of access to health care, food insecure, these are the folks who are really struggling. So as we begin to get back to life as normal, I'd ask you to remember how tough so many Rhode Islanders still have it. And remember this, in the blink of an eye, we could be back to where we were a couple months ago, struggling and surging up the curve. And yet there's no reason for that to happen. So our destiny's in our hands. And we have a shared responsibility to one another to follow the rules, be smart, so that we can continue to get people back to work and well. And just remember all the real human suffering that'll happen if we don't do that. I will say, I've said so many times, this phrase, the new normal, is one, I think we can do better than that. I think we can come out of it healthier, stronger, more equitable, better healthcare system, more resilient, more ready for the future. And next week, I plan to have a lot to say about that, around where my vision for Rhode Island, for our economy, for our healthcare system, as we come to the other side of this virus. Okay, I want to take a minute to talk about the 4th of July weekend. Obviously, it was a huge weekend. I will be honest, I went into the weekend with a lot of concern for what might happen. We had a lot on the line this weekend. There's no doubt about it. We had a lot on the line to make sure that we kept a lid on the virus. And by and large, I feel good about what we saw. The beaches were busy. It was a beautiful weekend. The beaches were busy all weekend, but we never reached capacity in our parking lots. So that was a good thing. DEM passed out thousands of masks at all the beaches. And as a result, we saw much better compliance with mask wearing. A couple of weeks ago, we had a lot of issues with mask wearing. Not this weekend, by and large, not perfect, but there was a lot more mask wearing in the bathrooms, at pavilions, in parking lots. We gave away thousands of masks. The DEM was out in full force at the beaches, at the parks, asking folks to break up if they were congregating. And in general, people were patient and compliant. We still had some issues. People were not friendly, not patient. And I would just say, don't do that. People from DEM are just trying to do their job. They're just asking you to do the right thing, follow the law, and keep Rhode Island safe. So, don't take it out on them. They're just trying to do their job. But by and large, people were following the rules. Our business inspectors were out. We had a lot of inspectors out all weekend long. They checked in on hundreds of businesses. We focused primarily this weekend on restaurants and retail. And I would say overall, the vast majority of employees and customers were doing the right thing. This should give you confidence as a Rhode Islander. Everywhere we looked, we saw good compliance with mask wearing and excellent compliance with high-touch cleaning. More than 95% of the establishments did, there was excellent compliance with cleaning of high-touch surfaces. I would say businesses are making a huge effort to make hand washing and hand sanitizing options available. That was excellent. We saw that everywhere we went, well over 90% of our businesses. And so that was good. Couple of things that I need to ask you to try harder. Too many restaurants were not taking the names and numbers of the members of the party for the reservation. More than 20% of the restaurants that we visited, there wasn't a regular way for the restaurant to take down the name and phone number of somebody in the party. And that's a problem. Why is that a problem? Because if there's an outbreak at the restaurant, or if the waiter or waitress gets sick, we need to call you. We need to be able to call you and let you know that you've potentially been exposed to somebody with the virus. So it's in your own interest that we can be able to get in touch with you. This whole, our whole effort is around testing and contact tracing. One of the very best tools we have is contact tracing, tracking you down as quickly as possible to tell you you've been in close contact with somebody who tested positive. Or if you've tested positive, knowing that, so we can call all the other people who've been in touch with you. So I would say we need to do better. We need to do better at that. 20% is not okay. It's a simple thing to do. When you call and make your reservation to go out for dinner, give your name and give your phone number. Not your address, name, and phone number. It has to happen every time. Not 80% of the time, 100% of the time. It's easy, it's essential, and I'm asking everyone to do better. Also, for your contact tracing notebooks, keep it up. I'll admit myself, sometimes I forget a day or two. I have it open on my desk and I say, oh, you forgot. You have to go back and write it down. Please keep that up. It'll save lives. It's a simple thing. Write down who you're in contact with. And then if you haven't downloaded your Crush COVID RI app, now's a great time to do it. Lots of people are using it. I think we've gotten feedback from people who are using it that it's not invasive at all. It's a help. And if you haven't done it, I'd ask you to do it. In more than 10% of the restaurants we inspected, we observed crowding and too much mingling. So that means people weren't 6 feet apart. We have to do better. 10% is too high. So if this weekend, if you found yourself in a crowded restaurant, in a church that was crowded, in a lobby that was crowded, in line for the bathroom, too close to the next person, that's a problem. You know, just sensitize yourself to the fact that if you find yourself crowded by people, move, get out, move, get some space, go outside. That is the problem. This virus, it lives, spreads, and thrives when people are too close together, inside or outside. And I would say, if you look, you know, don't listen to me when, around bars. You don't have to take my word for it. Look all around this country right now. We are having, the rest of the country is having huge issues with bars being the vector of spread of this virus. No bar in the state of Rhode Island should be operating as a bar. You operate as a restaurant. There should be no congregating at bars, period. It's a pretty simple rule to follow. You're not allowed to go up, order a drink, and hang out at the bar. And in a minute, I'm going to talk about enforcement. We're going to really start to crack down on that. You can serve drinks, you can sit and have your dinner, you can have your drinks brought to you. No congregating at bars. So with all of that in mind, I want to talk for a second about how we're going to be changing our enforcement as we move forward. And I've said for many weeks, months, as I've been up here, our goal was not to be heavy-handed. Listen, I know how hard this is for restaurants. I talk to people who own restaurants almost every day, and my heart goes out to every one of you. I also admire every one of you for how creative you are. This morning I had a call with a couple dozen restaurant owners on Block Island, and it's tough. It is really hard. It's hard on your businesses, and we're asking you to do superhuman levels of creativity just to stay in business. And so I want to thank you for being so cooperative. And by the way, the vast majority of restaurants are being cooperative. And it's not our intention to be heavy-handed, because we recognize what a tough time this is for you. But I will say this, if we don't follow the rules and if we don't enforce the rules, then we're going to get into trouble, the virus is going to spread, and then we're going to have to close the restaurants again, which is the absolute last thing that we want to do. All across the country, that's what you see is happening. States that had bars and restaurants open have closed them. States that had beaches open have closed them. States that were scheduled to open restaurants decided, no, we're going to wait a few weeks. Earlier this week, Texas, California, Hawaii, Missouri, Montana, and Oklahoma set single-day records for new cases. And they're all ratcheting back the way they're opening their economy. I don't want that to be our story. I don't want to do that. The only way that I won't have to do that is if we try a little harder to comply. Now, when we began, we said we're going to have a very light touch with enforcement, but now everybody's had more than a month to know the rules, understand the rules, and figure out how to follow the rules. And while 90% of establishments are complying, it's that small percent that aren't that are going to get us into trouble. So we are going to start to change and increase the way we do enforcement. It's also a fact that when we have more of an influx of people from other states who aren't necessarily used to the rules in Rhode Island, it gets a little bit harder for us to do enforcement. People coming here from other states where mask wearing isn't mandatory, where they're a little more casual in their attitude about the virus. And so that puts a greater burden on us in Rhode Island to look out for each other and help enforce the rules. Think of it as your shared responsibility to one another, to other businesses, to the people of Rhode Island, in order to follow the rules. So going forward, the rules for businesses our enforcement will look a little different. If we see egregious disregard for the rules, like a blatant disregard, we walk into a restaurant and the place is packed, there is no effort to impose social distancing or mask wearing, people lined up, crowded at the bar, really blatant disregard for the rules, you're going to be immediately issued a compliance order, or you might be issued a fine right there on the spot. The second time it happens, you're going to be issued a fine, or you might be shut down, the business, until you demonstrate that you've made appropriate changes. I want to mention, by the end of the day today, we're going to have the updated regulations with the fines and the updated regulations and enforcement posted online at dbr.ri.gov. For less significant violations, but still important, things like lack of signage, issues with mask wearing, not egregious, honest mistakes, you're going to get a warning. You're going to get a warning. The second time around, you'll get a compliance order or a fine. And again, check out, by the end of the day, dbr.ri.gov. And you can go to the website by the end of today. We're going to attempt to clarify the rules and clarify the enforcement. You can also go to this website to register a complaint. So if you see a business isn't following the rules and you want us to check it out, go online and tell us about it. File a complaint, dbr.ri.gov. I will say we do hear all the time from people saying, I went into such and such a restaurant, it was packed, I didn't feel safe, so I left. Well, let us know about that. I want to say this. I have instructed our inspectors to work in partnership with businesses. I want to be very clear. We don't want to shut you down. I want you all open and making money. And the vast majority of you are being creative and following the rules. And if you're trying, then we're going to work with you. And we're going to help you out. We're going to give you guidance. We're going to give you a warning. But I have to tell you this. There are those of you out there, and you know who you are. You're not even trying. Your own employees, your own hosts and hostesses are whispering to your customers, don't worry about the mask. Oh, it's okay. Oh, we got this. And we're going to crack down on you because it's not fair. It's not fair to the rest of the restaurants. If because of your noncompliance, I have to do what all these other states are doing and shut down all restaurants because of a small handful of folks that are willfully ignoring the rules. And you know what the rules are. We're not out to get you for a small infringement, a plexiglass that's in slightly the wrong place or slightly the wrong size. But we are out to get you if you are consistently, night after night, allowing large groups of people at your bars, in your restaurants, crowded for hours with no mask wearing. So I want to be clear about that. And I would say to all of you, don't let yourself be part of an outbreak. Ask, how can I be part of a solution? What's happening around this country right now is pretty scary. Hospitals filled, 90% ICU capacity filled. Houston, Phoenix, Arizona, Florida. Governors telling people to stay home. Ohio, 6 counties being, essentially shut down. There is no reason that has to be Rhode Island. Right now, Rhode Island stands out to the nation as a shining star of how well we're doing. And it's my goal to work with you to keep it that way. And a huge component of that is no crowds. So if we see you, we're not going to be afraid to fine you immediately and shut you down if we need to. I want to take a minute to talk about testing. Over the past handful of days, my office and the Department of Health have been receiving a lot of questions over the past week around travel, people coming to experience Rhode Island for the summer. As the governor of Rhode Island, I want to say welcome. We have the best beaches in America. There's no place better to spend a summer weekend than in the Ocean State. So we'd love to have you visit us and enjoy our beaches and restaurants. But we do have rules. We have rules that we expect you to follow. If you come here, we expect you to follow rules around mask wearing and hand washing and staying in your hotel or your house if you're sick. If you're traveling to Rhode Island from outside of the United States, you must quarantine here for 14 days. Nothing's changed. So if you're coming to Rhode Island from a international destination, no trips to the beach, no social gatherings, no outdoor dining, no indoor dining, 14 days quarantined. If you're traveling to Rhode Island from one of the 28 states that has a 5% or greater test positive rate, you should quarantine for 14 days. If you're here, quarantine for 14 days. That's the gold standard to keep us safe. However, we know you're here and you want a vacation, enjoy your vacation. So as an accommodation around the quarantine, we've made an exception that if you test negative, you don't have to be quarantined while you're here for your visit. You could do that in two ways. You can fulfill the exception requirement in two ways. You can get tested in your home state in the 72 hours before you travel to Rhode Island, and then show us some kind of proof that you've been tested negative in your state within 72 hours, or we're happy to test you here in Rhode Island once you get here. If you get tested when you're here, you have to stay quarantined until you get the negative test. Obviously, if your test is positive, then you have to be in isolation. If you come to Rhode Island as a tourist, so you're not a Rhode Islander, you don't want to quarantine, instead you want to get tested, you will have to pay for your test out of pocket. It'll be about $100. We have set up 10 testing locations around the state, specifically where tourists can go. It's the list of those 10 clinics is available at health.ri.gov/COVID. So, and we're going to have signs all around the state on this. We're working with hotels and rental properties, but just so everybody knows, for tourists coming here, you should quarantine, but if you don't want to, go get tested. Go on the Department of Health website. There's one of 10 places you can get tested. You will have to pay out of pocket. It'll be about $100. You'll get your results within a couple of days. And in the time that you're waiting, you do have to quarantine. Now, I want to say this. These guidelines I've just said around self-quarantining and testing, that applies to people who are coming to Rhode Island from one of these other states that has a more than 5% positive rate, who are here, for social reasons, for here because they're on vacation. Those requirements around travel don't apply for public health workers who are coming here, a healthcare worker traveling for your job, if you're coming to Rhode Island for medical treatment, if you're coming to attend a funeral, coming to attend a memorial service, coming here to get your groceries or gas or medication, pick up your kids from camp, a work-related visit to Rhode Island. But it's primarily for tourists who are here. We want to make sure you get yourself tested so we know you're here safely. Again, we want you to come. I actually think Rhode Island's a fantastic place because we do have such a we have a lid on the virus, and we have great restaurants and great beaches. We just want you to come here, follow our rules, and be safe. Finally, I want to take a moment to briefly address visitation. I'll say one of the hardest parts of managing through this crisis are the stories that I have heard from people who haven't been able to visit their loved ones in nursing homes and in hospitals. And these are heartbreaking stories. I've heard from so many people um, whose like husband died while he was in a nursing home and they couldn't visit to say goodbye. Parents whose kids might be at a hospital, maybe at inpatient for mental health services at Bradley, or maybe their kids in the hospital at Hasbro, and they can't go visit their kids. That is brutal. And it's been a hard decision. That has been a hard decision to hold the line on that as long as we have to keep a lid on visiting. But we've done it in light of what we thought was necessary, especially with respect to nursing homes, what we've seen happening. And also I've been hearing from, in this business I'm in, you have to really listen to all sides. I hear from the staff in the hospitals and nursing homes, and they're afraid also. They want to make sure that before we allowed visitation, they could do it safely. So having said that, we are finally in a place where we can start to ease up on the visitation rules, and I'm really pleased to be able to make some announcements today. As some of you have already reported, as of today, we're allowing nursing homes to once again accept visitors as long as there are some additional public health precautions in place. And Dr. Alexander Scott is going to talk about that in detail. Obviously, we're asking you to just be responsible. Keep your visits short. Mask wearing is essential. Pre-schedule your visits if possible. Limit the visit. Don't bring your whole family all at once. But we feel it's time for you to be able to time for you to be able to go and visit your loved ones in your nursing home. Today, I'm also now announcing updated guidelines for limited hospital visitation. The specifics on that are going to vary a bit hospital from hospital. Dr. Alexander Scott, in a second, is going to take us through the details of how we're going to be handling hospital visitation. But as of today, you can visit a loved one in the hospital and you can visit a loved one in a nursing home under new guidelines. And I want you to say, I'm sorry it's taken so long, but in light of everything we faced, we felt it was the right thing to do to keep everybody safe. So with that, I'm going to turn it over to Alexandra. She's going to go through some more details.
Thank you, Governor. Good afternoon, everyone. Thank you for being with us today. To get us started, I'll give an overview of the data for today. We have 41 new cases to report. There are 56 people hospitalized. 5 people are in the intensive care unit across the state, and those 5 people are on a ventilator in the ICUs as well. Sadly, we have 2 new COVID-19 associated fatalities to report for today. Both of these people were in their 80s. Our sympathies and prayers are certainly with the families of these 2 Rhode Islanders who have passed away, as well as all of those who have lost loved ones during this time. So as the governor mentioned, we have updates on visitation with our healthcare facilities, and I'm going to walk us through them. Last month, the Rhode Island Department of Health provided guidance to nursing homes and assisted living facilities on how to develop safe visitation plans. We asked those facilities to work on a comprehensive plan, take the steps they needed to put in place the safeguards that would be important. And as facilities continued to work on their plans, RIDO allowed facilities to start communal dining and communal activities about 2 weeks ago within nursing homes and assisted living as a way to begin the process and to test out the safeguards that they're working on and putting in place. Then last week, for facilities that had not submitted their own visitation plans to RIDO, we provided a standard basic plan for safe visitation so that all nursing homes and assisted living facilities have a basic plan to follow if they don't already have their more comprehensive visitation plan, which we are continuing to encourage all facilities to submit to us. With those steps in place, as the governor just shared, as of today, facilities are authorized to start scheduling short visits with guests to see their loved ones in nursing homes and assisted living facilities. We are authorizing these scheduled visits to start occurring. We encourage you to reach out to your facility and work with them as each facility will engage in the process to get this going. The majority of facilities have done their part and are ready to get started, engaging with you and scheduling visits and moving forward. There's a small group that wants to take a little bit of time, a few days or a week or so, to advance towards that visitation. It's either because they have had recent cases, which is something we are working closely with facilities to respond to, that they may need to readjust if they have cases, clusters of cases, or because they need a little more time to implement their safe visitation plans effectively. Although this is just a small group that may have their timing slightly different, the basic infection control measures that are required to be in place for nursing homes and assisted living facilities are overall consistent and follow as such. Here are some examples. We are requiring that visits are scheduled in advance, as has been shared, so please make sure that that's an important first step in calling the facilities. The visits will be kept short as we get this started in 30-minute increments and be able to work from there. Facilities must actively screen everyone for symptoms of COVID-19 before they enter the building. Facilities will be keeping a daily log with names and contact information for all visitors as well. We are also encouraging outdoor visits, as that is a preferred approach to support facilities in doing. Regardless of the location of the visit within the facilities, visitors must maintain a 6-foot distance from the residents they are visiting, as well as from staff, and all visitors must wear a cloth face covering in order to enter the facility or engage in the visitation. If a facility has a new case, the Rhode Island Department of Health will be on it immediately, work closely with the facility as we have been doing, and visitation could be halted again. So we are working closely with continuing to monitor that. We are also lifting the restriction that didn't allow barbers and hairdressers to go to nursing homes and assisted living facility. There's a clear understanding that the emotional well-being of the residents, both in appearance and in how they're feeling and engaging with others, is a key part to this overall recovery. We recognize that this has been an enormously challenging time for nursing homes and assisted living facilities, for the residents, the staff who love them, and the administrators as well. And in many ways, more is being asked of all of them now as well. So I want to thank all the staff and the facility administrators for their partnership over the last several months, their diligence in doing the best to keep residents safe, and their patience and flexibility. I also want to thank the residents and their family members who have also had a very challenging time through this. Thank you in advance for your patience as we work to balance patient and staff safety with your desire to see your loved ones. Halting visitation, as the governor shared, was a necessary step to protect residents, but it was also an extremely hard decision and not something that we ever want to have to do again in such a broad way. Another change that I will highlight is related to the hospital visitation, as has been shared. In early March, the Rhode Island Department of Health developed a 3-tiered visitation scheme for hospitals to follow. Since then, hospitals have been operating at the strictest level, which prohibited visitation except for some very specific scenarios. As of today, we are allowing hospitals to move to level 2, which allows for visitation during limited visiting hours. Those limited hours will vary by hospital. However, similar to the nursing homes and assisted living facility, there are some consistent requirements across all of the hospitals. Screening for symptoms will be happening at designated entrances. Face cloth coverings will be required at all times. Visitors will not be allowed to congregate in areas like waiting rooms and gift shops. The expectation is that people will go directly to the patient's room and remain there unless they need to step out because of care being delivered to the patient. These are just a few of the examples of the requirements that will be in place. I want to thank all the hospitals throughout the state for their partnership on this approach to visitation. With the support of the Hospital Association of Rhode Island, which we also thank, the hospitals have worked together to move in a united front forward with these steps. They have been phenomenal partners throughout this response. So again, to the staff and leadership of each and every hospital throughout this state, thank you. We're enormously grateful for all you have done and continue to do. And in the same way, I want to thank nursing home and assisted living facility residents and their families, and be able to thank hospital patients and their families for your patience and for your commitment to your loved ones as we work towards taking the next step in allowing for that engagement. Patient safety, staff safety, and the need for patients to see their loved ones are all very important. We appreciate you working with us and understanding as we have taken this cautious, measured approach. And with that, I will pass it back to the governor.
Good afternoon. How are you? Nearly 3,000 people have signed an online petition requesting that you free up some of the federal money for small businesses. We talked about this almost 6 weeks ago. And I asked your office for a statement yesterday. They said, in part, the governor is working hard on a plan to provide additional support to small businesses. So I have a couple of questions, like, specifically what that hard work is, but also, I'm sure you talk to small businesses. You referenced the restaurants. And if you had any of the small businesses say, Governor, we get that the state's in a really hard position right now, that you have this huge budget hole to fill. And even though Congress allocated this money specifically for us and not to fill budget holes, we'll sacrifice for the big greater good. Have you had any small businesses tell you that?
Yes.
Don't give it to us, save it for the budget hole?
We have. So let me address it. I'm glad you brought it up. And we did talk about it before. So Congress is making this very difficult because they're not telling us whether they're gonna send more money. And they've said time and time again, one of the solutions may be to just allow more flexibility with the first fund in order to fill budget holes. Having said that, listen, I hear what they're saying. I have been trying, just today I talked to the Secretary of Treasury. Tuesday we had a call with the White House. I talked to the congressmen and senators of our delegation constantly. I've been trying to get a little more visibility into what Congress might do. At this point, I am increasingly confident that Congress is going to do the right thing at the end of the month and send an additional stimulus to the states. And so with this press conference next Wednesday, I am going to be rolling out plans for how we use some of our $1.25 billion exactly for this.
So Congress said you can't use it that way, although you're hopeful. It said specifically to fill small business.
Yeah,
Some
that's
businesses are telling me
yeah.
they've been waiting 6 weeks for you to say
Yeah.
this, Governor. Some are not going to be around at the end of July. So it's nice to say I'll be back in a week. There's businesses that they're hanging on by a thread, and if they go out of business, that's tax revenue that you don't get.
There's no doubt about it. Listen, I'm sympathetic. I get it. I do get it. You also have to realize, and this is my job, and I'll own it, and I've said from the beginning, there's no easy or correct decisions. And we are trying to, we've gotten the money out the door to pediatricians, we've gotten the money out the door to childcare centers, there's been over $1 billion of PPP that's been out the door to businesses in Rhode Island. We set up a small business fund, we set up a housing fund, and still we need to do more.
You control.
Actually, that's not true. Most of that is from the PPP is federal, but everything else I just said is from the fund that I control. Having said that, look, you're right. And the work we're doing, and Stephanie can talk about it too, is talking to businesses. There is no way that we'll be able to fill the entire hole, but we do need to start getting money out the door into the hands of businesses.
So you talk to other governors, you tell us, oh, I just got off the horn with governor this and governor that.
They're
Have you
all-
talked to the governors of Alaska, Mississippi, Louisiana, and Pennsylvania, who have figured out a way to thread that needle? They have addressed the health, the contact tracing, the testing, all of those things that you talked about. They've given 10, 15, 22% of that allocation they've gotten for their state, and they've still figured out a way to balance their budget.
They have not, actually.
Have you asked them for
They have
advice?
not.
Have you asked them for advice?
Not them, but I talked to plenty of governors. Let's be clear about this. They have not figured it out. They're gambling. And that may be the right choice. I'm not criticizing them. Every governor is in a tough spot on this one. But I'll tell you right now, if we have to balance our state budget without another dime from the federal government, the cuts and layoffs that we're going to have to do are going to be crushing to every Rhode Islander, including small businesses. So I think
You
it's,
could have saved tens of millions of dollars if you had started what we talked about, furloughs and layoffs 10 weeks ago. You could have
Not
saved
really.
tens of millions.
not really. We have started that sounds easy. Listen, here's the deal. We hear from small businesses, they need help. We're going to give them relief. We could argue all day long. Should have I done it 2 weeks ago or 2 weeks from now? I have to make the best decisions I can with the information that's before me. We are in touch with businesses. We're trying, we've made PPE available. We've made cleaning materials available. There are some governors who have moved faster. I'll acknowledge that. Most have not, but that should be clear. And I'm operating in like great uncertainty. But I will say, I agree, it's time. And we're going to try to start getting the money out the door next week.
So do you now?
Oh, so we're good. Yes. So let me tell you what we're thinking of and how we're going to figure it out. So we are spending an enormous amount of time hearing from businesses, what do you need the money for? How quickly do you need it? Is who's getting the most hit? Is it restaurants? Is it gyms? Is it minority-owned businesses, small businesses? So we're putting the, final touches on our proposals. It's most likely going to look like small grants to all small businesses who can qualify. There'll probably be something special for restaurants, maybe something to help them buy supplies, just dollars in the hands of small businesses.
How quickly can you get that out the door after next Wednesday?
Pretty quickly, like right away. We know, I hear it. I want them to survive. And we want to get the money in their pockets as soon as we can. I don't want, listen, the last thing I want is for them to go under. It's just a difficult situation, but I hear it, and it's at a point now where it's got to happen, and we'll work fast to get the money out fast, and it'll be in the form of grants, not so much loans, just cash. They need cash to pay the rent, to do what they need to do.
Governor, sticking with the business conversation, first of all, on enforcement, how is that a public-facing operation that DBR will be running out? In other words, will the public be able to see these enforcement officers entering businesses and assessing,
Yeah.
will there be the online posting of those businesses which have failed strike one or strike two or been fined? Is that something that's going to be public? And then also, what about the micro entities that, because they haven't received funding, aren't able to afford to get to the standard of safety that you're out there? You might be putting people further in the hole because they're not getting the funding they need right now. If that makes sense.
Yeah. So I'm going to let the Commerce Secretary answer that. And then if you want me to comment further, I'm happy to.
So the governor, in describing the enforcement approach that we're taking, talked about a system where after an initial violation, typically there would be a compliance order or there could be a fine. There are important exceptions to that. Egregious cases, as the governor expressed it, they may actually receive one of those consequences sooner. In those cases, we are going to be posting the information pertaining to those businesses on the DBR website. That's dbr.ri.gov. And that will be a list that includes the inspectors under this task force that's interagency across the state government. So DBR will be the site at which that information will be located. And I can tell you that there have been 7 compliance orders and there was 1 immediate compliance order. And by tomorrow, we will have information to that effect online. On your question about micro businesses, I think this gets at your question. The governor has been especially focused on the smallest businesses all along. To note, for example, in helping businesses achieve the well over $1 billion in PPP loans that businesses in Rhode Island did receive, the governor ensured that there were special efforts for smallest businesses. There was outreach with a coalition of organizations, the Hispanic Chamber of Commerce, the Rhode Island Black Business Association, and the United Way, chief among them, where we ensured that information was provided to the smallest businesses, fewest employees, with an emphasis on minority enterprises and women-owned enterprises. And we set up a special fund. As you may recall, Goldman Sachs charitably contributed. We set up a special lending system for unbanked businesses to ensure them access to federal funds. So it was not by chance that micro businesses were given special emphasis. It was very deliberate. And we're very grateful to those partner organizations for taking on that effort. We will likewise conduct outreach to the smallest businesses in Rhode Island, to minority businesses, to women-owned enterprises, when we undertake the new small business grant program that the governor has framed today.
Governor, changing gears a bit, can you talk a little bit about test results and timing? We're hearing from some people that it's taking up to a week, some nursing homes even staff testing taking sometimes more than that. I mean, what's causing this delay and what's being done to really speed that up?
Thank you for that question. We are very focused on this. In terms of what's causing this delay, as other states are starting to ramp up their testing, it is causing the private commercial labs that send their testing out of states to have to deal with more testing being done in those other states as one piece of the issue. We do have within state, our state health laboratory doing a very good job in terms of turnaround time. And we have primarily focused them on responding to outbreaks and in particular handling our nursing home cases. So we are working towards a process supported by technology that will allow us to continue to do better with the in-state laboratory capacity, particularly for those commercial labs, to be able to increase the turnaround time better. We acknowledge that it's a challenge for the individuals to wait that amount of time. That's not ideal, and we're focused on addressing it. We also acknowledge that the laboratories, both the commercial ones as well as the state health lab, are handling hundreds and thousands of specimens each day. So we want to find that balance of making it so that people are not waiting 7 to 8 days and bringing that closer to a more appropriate 3 to 4 day turnaround time.
So the work being done in the state labs, but what is, I guess, the workaround to the private labs and that delay? And also, do you think it was premature to close the rapid testing site at Twin River on that front?
So for the workaround of what's being done, there are multiple steps in place. We are looking for and have completed the process that we're now evaluating, having strong testing partners to build capacity within the state. We're also supportive of those other commercial laboratories bringing on the instrumentation that will allow them to do testing within state and help address that turnaround time piece. And we're also looking at ways to get our technology to support the state health laboratory, maximizing the capacity they have with the very excellent turnaround time. So over the coming days and couple of weeks, we're expecting to see the improvement that we know is necessary. In terms of pulling back on the rapid ID Now test, we are still comfortable with the decision that was made there. It's certainly exposed here, but what we were experiencing with those test results highlight the importance of being able to ensure that if that testing continues, it really focuses on people who have symptoms and are being done in alignment with the healthcare delivery system, so that if there are any false negative results from that testing approach, we have a mechanism to be able to capture that. So with knowing what's there, we want to be able to continue with a small focused group and then really do the steps that I just shared on increasing and improving the turnaround time.
Governor,
Just maybe a quick question for you, Dr. Scott. Going off of nursing homes and visitations now being allowed, why take this risk now, I guess? I know outdoor visits are encouraged, but there's still that risk indoor if even an asymptomatic person goes in, takes their mask off, coughs quickly. Why take that risk now?
Absolutely. It's a challenging question to answer with two tough decisions that are there. I echo the governor's mention of recognizing how heartbreaking some of the stories are. And as I've shared with nursing home leadership, assisted living facility leadership, and as hospital leadership understands, given where we are with the data, the control that we are continuing to maintain over the virus, given what families have been patient with and have experienced, it's time. We want to do it now, do it safely, do it cautiously, and have the ability with our support to make adjustments as we need to.
Governor.
To that point, so as the doctor said, we are working to reduce the wait time with the commercial labs and frankly, reduce our dependency on, there are certain commercial labs that have just taken too long. And so we are reducing dependency on them and bulking up in other areas. And so we're going to fix it. I do want to say this though, and it's a very important thing. If you are sick, you should be staying at home anyway. So we do hear from folks saying, oh, I've been waiting for 4 days for my test. I'm anxious to know. And of course I understand that. And of course we're going to do our best to make it quicker, but they're sick. They still have symptoms. They need to be staying home. You can't go to work. You can't go to school. You can't go to camp if you're sick in any way with any symptoms. So of course it's frustrating to have to wait for your test result, but I can't say enough times, if you're sick, you have to stay home. We've been talking to businesses a number of businesses who've said they've had a handful of cases in one building, whatever, and all their quote unquote outbreaks relate to a person going to work when they felt sick. So I just wanted to hammer that home.
Governor, Brown University announced a plan to move into trimesters. Have you seen it? Have you spoken to President Paxson? Is that the direction you think some of our other universities may want to look at?
So it's up to them. It's up to them. We have been, months ago, we set up a team on my team to deal with higher ed. We gave them a template and guidelines that they had to follow. We required every college to submit to us their opening plan so we could make sure they had a comprehensive plan. And then beyond that, we said it's up to you. I think it's innovative, and they have really robust plans around infection control, keeping the students far apart, random testing. So I'm not going to tell any other college that they should do that, but it does seem sensible to me.
And what do you want to say to the students and families of URI students? You have less of them can live on campus, And also you have the town of Narragansett trying to limit the
Yeah.
number of non-relatives that can live in a dwelling. It's a problem for URI students.
It is a challenge. In fact, tomorrow I'm meeting with the new chair of the board of URI to really continue to get into the details. What the town did, I understand. I think it's a reasonable thing to have done. It makes it harder for URI. And there's going to be a lot of students who live in Rhode Island who are going to wind up living at home and commuting. And that is going to make their experience different. Having said that, the folks at URI are working their tails off in order to make it so that the kids can go back to school, in school. And that I support fully. Right now, if you were to say to me, like, what's my top priority? I have many of them, and small businesses are weighing on me right now, as we just discussed, is getting our kids back to school, K through 12, pre-K through 12. I want to see kids in school, learning in person in August, or August 31st. And I applaud URI for coming up with a plan where the students are back having education that way. The accommodation is a tough one. And unfortunately, they're going to be kids. I call them kids. The older I get, the more I say kids. They're going to be students who live in Rhode Island, you know, the student who lives in Cranston, who can get an excellent education at URI in person, but they're probably going to have to commute, at least for a period of time.
Secretary Pryor, according to McKinsey, innovative malls are incorporating value-added elements that attempt to recast the mall as the new downtown: concert, art centers, spas, fitness clubs, farmers markets. These services provide a level of leisure and entertainment that can never be satisfied online. With regard to Providence Place Mall, sales and tax revenue and occupancy continues to slide. From fiscal 18, $12.3 million represented a 14% drop. Fiscal 19, we're down to $10.8 million roughly. Given COVID, it's unimaginable how low sales tax receipts will be in fiscal 20. Accordingly, anchor tenants are in trouble and or leaving, like Macy's potentially. Questions: given the burden the mall continues to present to a nearly broken Providence, will the state avoid these deals in the future where sales tax are largely shifted from one retail sector to another, with the private state giving up millions in sales tax revenues in order to subsidize private venture construction? Importantly, has the state of Rhode Island engaged in any contact with Brookfield Properties to discuss the mall's rapidly declining fortunes? And does the future involve lowering sales tax and restaurant tax to invigorate downtown small merchants, as well as state-financed private-public partnerships?
There was a lot in that question. It is an insightful question. Yes, we've been in touch with Brookfield and its predecessor owners over the years and recently. We have been in discussions with Brookfield far preceding the COVID crisis. Obviously, the challenges faced by brick and mortar retail themselves precede COVID by a lot. Americans are shopping more online worldwide. People are shopping more online. Brick and mortar retail in its old form is increasingly outdated. People are looking for more of an experience when they visit a destination like a mall, or in some instances, whatever real estate was occupied by a mall as it's reinvented. So those are the kinds of moves that Brookfield and other major mall operators across the globe do need to consider. On the lessons learned that you're asking about, I don't think it's obvious that the problem in creating Providence Place Mall was the dedication of sales taxes to enable that mall to have its very long and successful run. I don't think that's the lesson. We have not been in discussions with the mall's ownership about any official role for the state around such a mechanism or further subsidy. It has not arisen yet per se, not to my knowledge, and I don't believe at all. But I do think that what you're onto is the more important point, which is that malls need to reinvent themselves as centers of entertainment, and they need to consider COVID factors. So what forms of recreation will Americans, will certainly Rhode Islanders engage in? And we're up for that dialogue. It's a very complicated question.
But just one quick point. Largely, downtown Providence has been decimated in terms of its retail presence. The presence of a mall acted to siphon a significant amount of business from downtown merchants to this location, which is now largely becoming functionally obsolete. Add COVID to the equation, and you've got an implosion happening in the small retail markets here in Rhode Island. And as a result, the true future tax base of Rhode Island is in critical condition.
Well, that's not a question, that's a set of assumptions. I'd say that I'd love the dialogue about it, but I don't think the immediate conclusion one can draw about every single mall ever created, including central downtown malls with some outward-facing retail, like Providence Place Mall, that include other functions like movie theaters and other forms of entertainment already, that one can conclude the reason downtown is failing is that mall. I think that would be a stretch. I do think that the age of centralized interior-facing retail is at least in part over, and that we need to look to more creative mechanisms. You should note that under Governor Raimondo, we created from scratch a Main Streets program where we helped Main Streets across Rhode Island revitalize themselves. Things like facade improvements at small business locations, usually retailers, whether it's curb cuts or granite curbs or better lighting to make our main streets successful. And we've gone on to do a lot more to help small business, including the state's first ever state-financed small business loan program, all out of recognition that decentralized retail that has more of a homegrown neighborhood feel is more the future. And that as to centralized entertainment kinds of experiences, that's more what a mall needs to become. So would welcome further dialogue in the future, but I think that's responsive for now.
Last questions from Steve and then Kim.
Back to the subject at hand, Governor. Today, President Donald Trump suggested that he would withhold funding from states that do not open their schools in the fall. Do you find that your plan to reopen schools in the fall is in keeping with his desires? Do you see anything at odds in your plan to go back to school with his?
So first, let me say I don't agree with that approach of governing. The president has been so clear from the beginning that, he said to us all the time, you governors, you're on your own, you make the decisions that you think are necessary in your state. Wasn't even really there when we needed the support. So for him to then say, despite what's happening on the ground in your state, I'm forcing you to go back to school, otherwise I'm going to withhold aid. I think it's irresponsible, dishonest, and reckless. Having said that, I want to get kids back to school in Rhode Island. And I think we have a good plan for that to happen. I know there's anxiety about it. I know superintendents it's a lot of work for them. But our plan, our goal, what we're going to do is to enable kids to go back to school. And we're going to use some of our COVID money. We already sent out $50 million to school districts. We're planning to send out $50 million to school districts to help them, more cleaning, more transportation, et cetera. So bottom line is, I think it's vital for these kids to be in school, and we have a plan to do that in Rhode Island. And whatever the president does, I suppose is up to him, but I'm going to do what's right for Rhode Island, our school children, and our community.
Dr. Scott, I think this question is probably more for you. My colleague Eli Sherman has been really closely watching all of the data, and it appears that the state has revised its testing data to show that more people have tested positive than what was originally reported. And his calculations show that the all-time positivity rate jumped today from 6% to 10% because of that revision. Can you just explain why that happened?
We have updated our database overall. We did a revised approach with it. The percent positivity rate, I want to get back to you clearly on where we are with that number today, based on those numbers, knowing that we're continuing to collect the numbers in. What we have shown is what the number of total tested were, and then what the number of total people in terms of the actual individuals who were tested, knowing that some people could get a test more than one time. And we've wanted to be able to provide that data in more detail on the website.
So the data now shows just the individual people who are tested versus, if someone had been tested 2, 3, 4 times, it eliminates that. Should people be concerned, though, that this seems to show a higher positivity rate than what we had been reporting for some time?
So just to clarify the first part of that, we are continuing the total number of tests and then adding the number of people who are tested as part of it. We continue to have an overall very strong percent positivity rate. So I would not say that there needs to be a different interpretation on that, and we'll be able to provide some further clarity for you and for Eli afterwards. We have acknowledged that particularly our communities that were highest hit, that had more than 20% positivity rate, have decreased to that single digit number along with the rest of the state. We continue to keep our eye on the ball, knowing that we need to continue to monitor, make sure that we're watching the right indicators and responding to the outbreak data that we are getting in real time so that we can identify any early warning signs of where we may need to focus in a more pinpointed way.
Governor, quickly, just before the last question. You talked about tourists coming to Rhode Island, getting tests, having to pay, and all that. What about Rhode Islanders who are traveling to Texas, to Florida, to some of the southern states, coming back, and they don't want to have to quarantine? They've been down there for vacation, they've been down there for business. They're Rhode Islanders, they're coming back. Can they get tested for free, and where do they go?
Yes, the policy I said about paying out of pocket is just for non-Rhode Island residents. If you're a Rhode Island resident, you can come back and, go wherever you want. What's that? Yeah, go to right. You can go wherever you want. You can call your doctor and get tested. But we have this portal, which I have portal.ri.gov, where they can go and get set up and have free testing.
Policy is the same. You either have to get tested or you have to quarantine. If
Exactly.
Right,
Exactly. So if you're a Rhode Islander and you go on